Blue Cross Blue Shield of South Carolina Foundation is a statewide leader, partner, and funder addressing health gaps for South Carolina's economically vulnerable citizens and serves as an agent of change to support innovation and value-added public-private partnerships. They have had a long-standing focus on investing in the health and well-being of children and families. To hear more about their efforts, we are now joined by Erika Kirby, the Executive Director at Blue Cross Blue Shield of South Carolina Foundation. Erika?
Thank you, Catherine, and thank you to the NIHCM team and my fellow panelists, Dr. Kelleher and Dr. Green. This is such an important topic, and we are pleased to provide a snapshot of some of the activities and projects and efforts going on in South Carolina. So on behalf of our Board of Directors, again, I thank you for the opportunity to tell the story about what's been happening in South Carolina and some of our efforts. I'll first start with a little bit of an overview about the Blue Cross Blue Shield of South Carolina Foundation. As Catherine said, we are a statewide health foundation established in 2003, and since then have continued to focus on investing in all 46 counties across the state, looking to improve access to care. We've focused on workforce efforts, improving the quality and value, certainly investing in a two-generation approach, and all towards the eye of those that are economically disadvantaged and how do we bridge health and healthcare. In 2018, we took the added step of prioritizing three key health issues, those being oral health, mental health, and diabetes. And kind of embedded with that certainly is a focus on health equity, as well as looking at addressing the social determinants of health, not only from an issue perspective such as food insecurity, yet also from a convening perspective that as a corporate philanthropic organization lends us the opportunity to oftentimes pull different groups across sectors, across communities together. As we look at the status of mental health and well-being in South Carolina, and this certainly reinforce much of what Dr. Kelleher and Dr. Green have already addressed in terms of what was already happening with our mental health of our young adults and young students prior to COVID, but certainly in light of COVID, as we have looked at the impact of COVID prior to COVID. We have ACEs data, and we have almost two-thirds of our adults report at least one ACE, 22% report 2+, and we have roughly 16% report 3 or more ACEs. A study done through parents and caregivers in conjunction with our Children's Trust of South Carolina and the South Carolina First Steps organization found that 83% of these parents and caregivers reported higher levels of stress and anxiety just simply due to COVID. So we look at the rates of untreated depression, and here a graph pulled from partner organizations looking at suicide rates of South Carolina. And I dropped this in here because it provides context not only for South Carolina, yet as we look from a southeastern perspective, how we compare to rates relative to Georgia and North Carolina, our sister states. You know, we ranked 41st in the nation for overall child well-being. And as we look at the suicide rates, in blue is South Carolina continuing to increase and at a much unfortunate greater clip than our neighboring states. So the foundation strategy to support mental health, as indicated earlier, in 2018, really beginning in 17-18, we wanted to take a more intentional focus into how we were able to use our role, our statewide presence, and the different assets that we have, the convening power, the ability to connect individuals across sectors, and what was the unique role that this foundation could play in addressing mental health and well-being in our state. So our overall strategy includes a strong focus on prevention and earlier identification, yet also a connection to services and workforce, and building up a workforce for health, in this case, a workforce for mental health. And I make this note that when we intentionally looked at what we could uniquely and how we could uniquely serve our state, it's with recognition and acknowledgement and appreciation, certainly, that there are many partners in South Carolina doing phenomenal work. And there's a lot of organizations, efforts, conversations going on. So our intent was to identify how we could add in, accelerate, support innovation, address some existing gaps to what was already currently going on. So with the three main themes of our overall mental health strategy, we have a number of projects in each of these themes, but for today's discussion, I will just briefly touch on one example from each of these four. Starting with prevention, looking at increasing awareness and stigma reduction. We certainly have been able to have conversations with organizations. And in this slide, we're highlighting our partnership with NAMI, the National Alliance for Mental Illness in the South Carolina chapter. And when we sat down with them and had conversations, this was really back in 2018, about their footprint with using the nationally developed Ending the Silence curriculum for middle and high school students. It became clear that this was, as Dr. Green said, kind of creating this perfect storm of what else was going on and what needed to be filled, what were the gaps, what opportunities. And where they were at was often dependent upon smaller grant funding or very localized grant funding. So as we spoke with the team and leadership, able to really see opportunity of how we could scale the Ending the Silence curriculum, more of a regional approach. And so not only did this provide more consistent presence at a local place, but then also identified additional schools and counties based on higher rates of suicide and suicide attempts. So as we looked at this design, and really a co-design, if you will, of how to structure this to increase access, to have that more consistent localized presence, being able to braid funding together from other funds that either the state association had or even local chapters that had been received. Really being able to set our eye on reaching over 150,000 teens through this regional tiered approach, and being able to evaluate more intensively than what had previously been able to do in South Carolina. And with that information, being able to see a significant increase in the contact to the crisis text line and suicide prevention line. And because of these trainings, and these are just accomplishments to date, 180 students came up to the presenters, which include an adult as well as a peer that has experienced and have lived experience with mental illness. Over almost 50 students have been able to, were identified in immediate crisis need and were connected to services. Without this ability to scale and replicate and design this regional approach prior to COVID, I think we would have really found ourselves in a different place. What this has enabled is, even though they transitioned to doing virtual workshops and virtual trainings to the best of their ability, they had connections with schools prior to COVID. And so it provided an added mechanism and an added venue in which to support schools, the staff, the teachers, the families, and the students. Also, along the realm of prevention and moving upstream and looking at the adverse childhood experiences and protective factors, we have certainly recognized as a health foundation the connection between ACEs and health outcomes. in conversations with, in this case, our partner Children's Trust of South Carolina, among others, really to develop a more concerted statewide effort to address ACEs and build protective factors. And there's two components to this. And when we started these conversations, acknowledging that there were a lot of partners working on and supporting being trauma-informed, training workforce, making training available to the clients that they served, what was still missing and what did we need to do as a state to really accelerate our efforts at addressing ACEs and building protective factors. And where that landed was a two-prong approach to have better information to guide decisions and to then be able to use that information and data and translate that into action, all to impact health and address health disparities that we know have both short-term and long-term implications as a result of this trauma. The first element was the data and training arm. And so as we looked at this, we were able to enhance the data collection efforts within the state, and as a result of that, able to have county-level data. And this is just, there's an image of some of the county-level reports that were able to be generated. But being able to have that more granular level data, we all know health is local, right? And being able to have information that, to Dr. Green and Dr. Kelleher's point, of using information in a way that really depicts the populations and the communities most accurately. And so this county-level data has been instrumental in using to educate and convene partners. It certainly has been also helpful in soliciting information on aligning efforts, which I'll talk about in the next slide. But very much looking to identify per county and then at a regional level, what were some of the issues, the ACEs that were more prevalent versus in one county versus what may be seen in a different county. With this information, certainly trainings to increase the awareness, also different studies and benchmarks of what the perceptions of key individuals were regarding the impact of ACEs, their level of understanding, and what potential strategies and solutions could we take action on as a state. The second part of this overall commitment has been working at the community level. So not only what data do we have, trying to strengthen the data, but then how are we using this data to translate into action? So to complement, having this stronger, more robust lens and profile on the impact of ACEs in South Carolina at different levels, state, regional, and local, the development of the Empower Action Framework, which was, again, trying to help communities translate the what into the how. And so equipping them with the data, but then walking them through 5 steps of using this information and then looking across sector to engage schools, government, parents, different community members and providers, health systems, safety net providers, really all towards the eye of aligning on increasing their understanding of ACEs, how to build protective factors, and what they could do as a community as well as in their own organization to really change the dynamics and change the narrative within their community. So where this is at, 3 counties in the state are going through this framework currently, and they are using this to develop an action plan, really, again, to look at how they can look at this two-generation approach to build protective factors, to reinforce earlier detection, and acknowledging that this is really has been an opportunity to respond to the needs as partners were expressing they value the data, but they wanted to know how do we actually use it and what do we do with this information. And so this framework was developed in response, and throughout the end of 2021, all of these action plans will be developed. There was somewhat of a delay due to COVID and all things that 2020 brought us, but the coalitions didn't stop meeting. They had to change to virtual meetings, as so many conversations did, yet their commitment to these issues and these discussions, certainly that has been accelerated and elevated due to COVID, their commitment is something that we applaud and appreciate. Moving on to connection to service. This is, as a philanthropic organization, we tend to look at grant opportunities and needs. Sometimes the simple is the most effective. And in this case, it was partnering with the Mental Health America Green Bill as our state's satellite for handling the National Suicide Prevention Line calls. And what they needed was a more sophisticated capability to handle the calls coming in. So again, we started this prior to COVID, and we're able to have in place expanded phone capabilities going from one line up to 30 calls, so where they could significantly increase and keep calls in the state. And why this is important is prior to this expansion, when the calls were diverted to an out-of-state call line volunteer and recipient, they perhaps did not know the context and resources that were available to an individual locally. And so by keeping these calls in-state, we're not only able to connect them better to resources. To date, there's been a significant increase in call volume, but we've been able to, or Mental Health America Green Bill has been able to respond to that due to this increased capacity. It has allowed 29 lives to be saved since implementation of this phone system. And so again, just sometimes being able to hear what the needs are, what our partners are telling us, and responding to those needs and being able to fill in gaps that sometimes seems so basic, but in the absence of funding for supporting something like expanded phone lines, we would have missed the opportunity to support those individuals needing these services at such a critical time during COVID. The last element I will touch on is workforce. And so we've had a long history of promoting a workforce for health. And COVID certainly has elevated and surfaced the need for more mental health services, and certainly and more specifically to youth in schools, the school-based mental health services. In South Carolina, our State Department of Education and Department of Mental Health came together to outline a vision by 2022 that all schools would have access to a mental health clinician. And so the foundation has been able to support that vision through two projects. The first being the Engaging in Training with Compassion project to really create a trauma-informed and trauma-responsive school environment. This is a tiered approach that is working in 2 school districts, coupling the mental health centers and the schools within these school districts to provide training for all of their teachers, support and increase awareness of the school administrators, and then equipping the school-based mental health clinicians with added professional development and tools and resources and guidance on how best to support a particular child's needs. Second element of this has been our efforts to really look at how do we develop a sustainable school mental health workforce and a pathway to increasing the workforce of mental health clinicians specifically working in that school-based setting. And so this is looking at really providing clinicians with what it's like to work in a school setting. Oftentimes, as individuals leave with their degree in hand, they may not have had exposure to working in a school setting. So providing them an opportunity to know what it's like to work in a school setting, all towards the eye of increasing recruitment and retention and providing again, more robust services for right needs to address the right or right strategies to address the right needs at the time. And also as part of this, really beginning to explore different types of school mental health supports and how do we look at different individuals such as community health workers or behavioral health interventionists, perhaps those that are not trained as a mental health clinician, yet how do we look at expanding supports toward that multi-tiered system of support, Tier 1, Tier 2, earlier identification, increasing awareness to allow our clinicians to focus their time and meet the needs treatment-wise, but then also being supported to go down into Tier 1, Tier 2 of overall education awareness and really creating a much more comprehensive approach to school-based mental health services. For the sake of time, that's just a quick overview of each of these projects. Again, certainly it goes without saying that we owe much appreciation to our partners. There are many partners I did not mention during this, but it really is our effort at trying to meet the needs, respond to gaps, accelerate efforts and innovation. And I close with this slide. If anyone has been to South Carolina, we have beautiful beaches. And one thing that is true, though, is they're constantly changing. And so our challenge is to constantly evolve, know when to shift, how to shift in response to what's going on around us. And it is something that mental health is an ongoing commitment that we see and its connection to overall physical well-being, and appreciate the opportunity to mention a few projects and happy to answer any additional questions during the Q&A section. And with that, I'll turn it back over to Catherine.
Thank you so much, Erika, for your leadership and commitment and for sharing these excellent projects in South Carolina.